A question that often comes to mind is if I'm a hypertensive patient and I am prescribed an antihypertensive drug, when is the best time to take it? At night or in the morning? Now, typically what happens is people feel that if I take it at night, will it lower my blood pressure when I'm fast asleep? And can that be dangerous? Because people know that when you sleep at night, your blood pressure anyway falls. Unless, of course, you are a diabetic and you have something known as diabetes, which is affecting the autonomic nervous system, the nervous system that is not under your control. Such people, you may not have a blood pressure fall at night. So perhaps in such cases, you may want to take the antihypertensive at night. In most cases, people take it during the day because they feel that in the morning if I take it, and if it's truly a once daily drug, then as I'm doing my usual daily activities and I may be exposed to stress, emotions, etc., this drug will be able to control my blood pressure if it ever were to get elevated. But the best way of knowing whether I should take the drug at night or in the morning is if I do an ambulatory blood pressure monitoring test, and then I would know whether if this drug is given at night or in the evening as against in the morning, what is its 24-hour profile, especially how does it act in the morning. When we get up in the morning, along with us, our sympathetic nervous system also wakes up. And that leads to an increase in blood pressure and many other changes. Therefore, if I take the drug, for example, in the morning at say 9 a.m., this drug should be effective even from 6 a.m. to 9 a.m. the next day, because that is when the sympathetic nervous system surges. And this is why one has to be very clear about whether the drug needs to be given either in the morning or at night. Of course, with some drugs, if I give it at night, for example, a diuretic, then it may lead to the patient getting up at night to frequently urinate, and that may disturb his sleep pattern. So in such cases, people would prefer to give the drug in the morning. But otherwise, for an angiotensin receptor blocker, an ACE inhibitor, one could give it in the evening or the night. It's better in terms of the early morning blood pressure surge. For a calcium channel blocker, it is whether you give it at night or during the daytime, it doesn't make too much of a difference. But what is important is the drug should have a truly 24-hour duration of action, and obviously it should lower the blood pressure without causing a rise in the heart rate. That is extremely important.